everybody, Dr. Tripp with Cornerstone Physical Therapy. To go off our previous topic of dry needling, I wanted to give you a little bit more information about specific muscles that dry needling can be used for in regards to neck pain and headaches. So a common thing that we see in physical therapy is patients complaining of constant headaches, neck pain. They may not even know what triggered it or caused it to start happening, or they've dealt with chronic migraines for many, many years. And especially during this year in 2020, we've had more people working from home on computers, doing online learning. So just a little more stress and strain through the neck when you're sitting there looking at a computer all day long, or eye strain looking at your laptop that could be contributory to your neck pain and headaches. So when we talk about dry needling, there are a lot of different muscles in the face and in the neck that can be contributing to neck pain and headaches. But I'm just going to highlight a few that are some of the most common. So when we think about headaches, there's different types of headaches. There's migraines, there's cluster headaches, tension headaches, and cervicogenic headaches, which is just a fancy name for headaches coming from your neck. So when we're evaluating somebody with neck pain and headaches, we're palpating muscles, trying to see, does that elicit your type of pain? Does that bring on a headache? Or does that relieve pain if you hold pressure in a certain area? Some of the more common muscles that we see with headaches that we dry needle is patients complaining of a headache that starts in the base of their neck, and then they feel pain behind their eyes. So one muscle that's very beneficial in dry needling is your group of your suboccipital muscles. There's a lot of different muscles in this area. We don't have to go into the names of all of them, but they lie right here at the base of your skull. And if you suffer from headaches or migraines and you palpate these muscles, you might find some tenderness through there. And there's certain muscles back there that if we dry needle those muscles, they will elicit a headache type symptom or refer pain into the eye. One thing we see with dry needling is referred pain patterns. So where you find a tender muscle may not be where you exactly feel your pain or where you feel your headache. But then when you dry needle that muscle, that referred pain pattern from the dry needling here might wrap around, go into the head or into the eye. And that is a positive thing. So when we're dry needling and somebody says, I feel that in my eye, that's good because we found the muscle that could be contributing to your occipital headaches. Other muscles that we look at in regards to neck pain and headaches that a lot of people don't think about are anterior cervical muscles. We focus a lot on the back of the head and the neck. When you have a headache throughout your day, you might be trying to massage or grab your shoulders. But one thing that we also don't want to forget about is our supporting musculature in the front of our neck. These muscles can also be dry needled. Our therapists here at Cornerstone Physical Therapy, a number of us have our advanced certifications in dry needling. So we know how to safely needle your sternocleidomastoid or your scalenes, longus coli, deeper muscles on the front of the neck that could be contributing to part of this forward head posture. If these muscles are tight or inhibited in any way, that then tighten these muscles, put stress and strain, and it's hard for you to kind of get into this neutral posture, which at the end of the day, if you're working on your computer like this, you might have a headache at the end of the day. So we also want to address the muscles in the front of the neck and see if we can get these muscles working better to support your neck, to bring you into more neutral spine position so that the stress and strain between the posterior and anterior musculature is more balanced out. You could go into tons of details of all the different muscles that we can needle in the face and in the neck and in the head, but those are some muscles that you might not know could be dry needled, and that could prove very beneficial to symptoms into the head, the face, and even down into the shoulder or scapular area that could be coming from neck and head muscles. So if you have any other questions about dry needling, or if you're like, wow, that's really interesting, didn't even know that you could stick needles into the front of your neck, give us a call at 828-684-3611. Set up an evaluation if you've been dealing with chronic headaches, migraines, neck pain, and you can't figure out what's going on or how to eliminate or reduce your symptoms throughout the day. We're more than happy to help look at an ergonomic setup, perform an evaluation, and potentially do some dry needling if it seems like it would be beneficial to you. Once again, thank you for your time and for tuning in, and we will talk to you soon.